Okay, so now we're going to look at mobilizing the radiocarpal joint as a whole. So this is more of a general technique. You can try your best to approximate the proximal versus the distal roll. We're going to just show you the general technique to start for your foundational techniques. So what you're going to do is you're going to stabilize the distal radial ulnar joint by kind of compressing the distal radius and the distal ulna together. You're going to take your other arm and you're going to use your web space and you're going to wrap around the carpal rows as a whole, and you're going to try to be as close as you can between DRUJ and proximal carpal row first, and we're going to keep the wrist in just kind of a neutral position between flexion and extension. As we do that, we're going to start with just distraction, which is separating the two joint surfaces. Just very gently, and be mindful of if your partner or your patient has any type of underlying instability, as this could be a little uncomfortable for them, and we don't want to take them to their limits. Okay, after you distract just a little bit, you can apply either a dorsal or a volar glide. So a volar glide would be down towards the table, and a dorsal glide would be up towards you. Now, if I'm coming down, I'm stabilizing and providing a counter force with my top hand. Same thing if I'm coming up. So it's almost like an opposite to try to really make sure that we're mobilizing the two surfaces back and forth. If we're going dorsal, we're working on flexion. If we're going ventral, we're working on wrist extension.